Glaucoma. Glaucoma is the second leading cause of blindness in the world. Glaucoma is a group of eye diseases that can cause vision loss and blindness by damaging a nerve in the back of your eye called the optic nerve. It usually happens when fluid builds up in the front part of your eye. That extra fluid increases the pressure in your eye, damaging the optic nerve. The increased pressure in your eye, called intraocular pressure, can damage your optic nerve, which sends images to your brain. If the damage worsens, glaucoma can cause permanent vision loss or even total blindness within a few years. The symptoms can start so slowly that you may not notice them. The only way to find out if you have glaucoma is to get a comprehensive dilated eye exam. There's no cure for glaucoma, but early treatment can often stop the damage and protect your vision. Glaucoma is a silent thief of sight. Glaucoma has no symptoms in its early stages. In fact, half the people with glaucoma do not know they have it. Having regular eye exams can help your ophthalmologist find this disease before you lose vision. Your ophthalmologist can tell you how often you should be examined. What is the optic nerve? Your optic nerve plays a crucial role in vision. It sends signals from the retina, neural tissue in the back of your eye, like the film of an old-fashioned camera, to the brain. Your brain relies on these signals to create images. What is the main cause of glaucoma? Your eye constantly makes aqueous humor. As new aqueous flows into your eye, the same amount should drain out. The fluid drains out through an area called the drainage angle. This process keeps pressure in the eye, called intraocular pressure or IOP, stable. But if the drainage angle is not working properly, fluid builds up. Pressure inside the eye rises, damaging the optic nerve. The optic nerve is made of more than 1 million tiny nerve fibers. It is like an electric cable made up of many small wires. As these nerve fibers die, you will develop blind spots in your vision. You may not notice these blind spots until most of your optic nerve fibers have died. If all of the fibers die, you will become blind. Other causes of glaucoma. Less common causes of glaucoma include a blunt or chemical injury to your eye, severe eye infection, blocked blood vessels inside your eye, and inflammatory conditions. It's rare, but eye surgery to correct another condition can sometimes bring it on. It usually affects both eyes, but it may be worse in one than the other. Does glaucoma affect both eyes? Most people develop glaucoma in both eyes, although the disease initially may be worse in one eye. With open-angle glaucoma, one eye may have moderate or severe damage, while the other eye may be mildly affected. Over time, the disease damages both eyes. People with closed-angle glaucoma in one eye have a 40% to 80% chance of developing the same type of glaucoma in the other eye within 5 to 10 years. Glaucoma risk factors. It mostly affects adults over 40, but young adults, children, and even infants can have it. African American people tend to get it more often, when they're younger, and with more vision loss. You're more likely to get it if you are of African American, Irish, Russian, Japanese, Hispanic, Inuit, or Scandinavian descent. Are over 40, have a family history of glaucoma, are nearsighted or farsighted, have poor vision. Have diabetes, take certain steroid medications such as prednisone. Take certain drugs for bladder control or seizures, or some over-the-counter cold remedies. Have had an injury to your eye or eyes, have corneas that are thinner than usual. Have high blood pressure, heart disease, diabetes, or sickle cell anemia, have high eye pressure. What are the types of glaucoma? There are many different types of glaucoma. The most common type in the United States is called open-angle glaucoma. That's what most people mean when they talk about glaucoma. The drain structure in your eye, called the trabecular meshwork, looks fine, but fluid doesn't flow out like it should. Angle closure glaucoma. This is more common in Asia. You may also hear it called acute or chronic angle closure or narrow angle glaucoma. Your eye doesn't drain like it should because the drain space between your iris and cornea becomes too narrow. This can cause a sudden buildup of pressure in your eye. It's also linked to farsightedness and cataracts, a clouding of the lens inside your eye. Less common types of glaucoma include secondary glaucoma. This is when another condition, like cataracts or diabetes, causes added pressure in your eye. Normal tension glaucoma. This is when you have blind spots in your vision or your optic nerve is damaged even though your eye pressure is within the average range. Experts. Some experts say it's a form of open-angle glaucoma. Pigmentary glaucoma. With this form, tiny bits of pigment from your iris, the colored part of your eye, get into the fluid inside your eye and clog the drainage canals. How do you get glaucoma? There are two major types of glaucoma. Primary open-angle glaucoma. This is the most common type of glaucoma. It happens gradually, where the eye does not drain fluid as well as it should, like a clogged drain. As a result, eye pressure builds and starts to damage the optic nerve. This type of glaucoma is painless and causes no vision changes at first. Some people can have optic nerves that are sensitive to normal eye pressure. This means their risk of getting glaucoma is higher than normal. Regular eye exams are important to find early signs of damage to their optic nerve. Angle closure glaucoma, also called closed-angle glaucoma or narrow-angle glaucoma. This type happens when someone's iris is very close to the drainage angle in their eye. The iris can end up blocking the drainage angle. You can think of it like a piece of paper sliding over a sink drain. When the drainage angle gets completely blocked, eye pressure rises very quickly. This is called an acute attack. It is a true eye emergency, and you should call your ophthalmologist right away or you might go blind. Here are the signs of an acute angle closure glaucoma attack. Your vision is suddenly blurry. You have severe eye pain. You have a headache. You feel sick to your stomach, nausea. You throw up, vomit. You see rainbow-colored rings or halos around lights. Many people with angle closure glaucoma develop it slowly. This is called chronic angle closure glaucoma. There are no symptoms at first, so they don't know they have it until the damage is severe or they have an attack. Angle closure glaucoma can cause blindness if not treated right away. What happens if you have glaucoma? Open-angle glaucoma symptoms. With open-angle glaucoma, there are no warning signs or obvious symptoms in the early stages. As the disease progresses, blind spots develop in your peripheral, side, vision. Most people with open-angle glaucoma do not notice any change in their vision until the damage is quite severe. This is why glaucoma is called the silent thief of sight. Eye exam. Having regular eye exams can help your ophthalmologist find this disease before you lose vision. Your ophthalmologist can tell you how often you should be examined. Angle closure glaucoma symptoms. People at risk for angle closure glaucoma usually show no symptoms before an attack. Some early symptoms of an attack may include blurred vision, halos, mild headaches or eye pain. People with these symptoms should be checked by their ophthalmologist as soon as possible. An attack of angle closure glaucoma includes the following: severe pain in the eye or forehead, redness of the eye, decreased vision or blurred vision, seeing rainbows or halos, headache, nausea, vomiting. What are the symptoms of glaucoma? Signs of open-angle glaucoma tend to come on subtlety and gradually. That makes them easy to miss. Many people with open-angle glaucoma have no noticeable symptoms early on. That makes it incredibly important to have routine eye exams to detect this disease in its earlier stages. Because glaucoma damage is irreversible, early detection and treatment is crucial to prevent blindness. Closed-angle glaucoma has more severe symptoms that tend to come on suddenly. With any type, you may experience eye pain or pressure, headaches, rainbow-colored halos around lights, low vision, blurred vision, narrowed vision, tunnel vision, or blind spots, nausea and vomiting, red eyes. How is glaucoma diagnosed? It's possible to have glaucoma and not know it. Regular eye exams are important to catch glaucoma or other eye problems. Eye exams can assess optic health and vision loss. To check for glaucoma, your eye doctor may do one or more of these painless tests. Dilated eye exam to widen pupils and view the optic nerve at the back of the eyes. Gonioscopy to examine the angle where the iris and cornea meet. Optical coherence tomography, OCT, To look for changes in the optic nerve that may indicate glaucoma. Ocular pressure test, tonometry, to measure eye pressure. Pachymetry to measure corneal thickness. Slit lamp exam to examine the inside of the eye with a special microscope called a slit lamp. Visual acuity test, eye charts, to check for vision loss. Visual field test, perimetry, to check for changes in peripheral vision, your ability to see things off to the side. Treatment of glaucoma. The damage caused by glaucoma can't be reversed, but treatment and regular checkups can help slow or prevent vision loss, especially if you catch the disease in its early stages. Glaucoma is treated by lowering your eye pressure, intraocular pressure. Depending on your situation, your options may include prescription eye drops, oral medications, laser treatment, surgery, or a combination of any of these. Glaucoma treatment often starts with prescription eye drops. These can help decrease eye pressure by improving how fluid drains from your eye or by decreasing the amount of fluid your eye makes. Depending on how low your eye pressure needs to be, more than one of the eye drops below may need to be prescribed. Prescription eye drop medications include prostaglandins. These increase the outflow of the fluid in your eye, aqueous humor, thereby reducing your eye pressure. Medicines in this category include latanoprost, Xalatan, Travoprost, Travatan-Z, Tafluprost, Xioptan, Bimatoprost, Lumigan, and latanoprostine Bunad, Bazulta. Possible side effects include mild reddening and stinging of the eyes, darkening of the iris, darkening of the pigment of the eyelashes or eyelid skin, and blurred vision. This class of drug is prescribed for once-a-day use. Beta blockers. These reduce the production of fluid in your eye, thereby lowering the pressure in your eye, intraocular pressure. Examples include timolol, betamol, istalol, timoptic, and betoxolol, betoptic. Possible side effects include difficulty breathing, slowed heart rate, lower blood pressure, impotence and fatigue. This class of drug can be prescribed for once or twice daily use depending on your condition. Alpha-adrenergic agonists. These reduce the production of aqueous humor and increase outflow of the fluid in your eye. Examples include aproclonidine, iopidine, and brimonidine, alpha-GAN-P, Coleana. Possible side effects include an irregular heart rate, high blood pressure, fatigue, red, itchy or swollen eyes, and dry mouth. This class of drug is usually prescribed for twice daily use but sometimes can be prescribed for use 3 times a day. Carbonic anhydrase inhibitors. These medicines reduce the production of fluid in your eye. Examples include dorzolamide, Trusoft, and brinzolamide, Azopt. Possible side effects include a metallic taste, frequent urination, and tingling in the fingers and toes. This class of drug is usually prescribed for twice daily use but sometimes can be prescribed for use 3 times a day. Rho kinase inhibitor. This medicine lowers eye pressure by suppressing the Rho kinase enzymes responsible for fluid increase. It is available as Notarsidil, Repressa, and is prescribed for once-a-day use. Possible side effects include eye redness, eye discomfort and deposits forming on the cornea. Miotic or cholinergic agents. These increase the outflow of fluid from your eye. An example is pilocarpine, isoptocarpine. Side effects include headache, eye ache, smaller pupils, possible blurred or dim vision, and nearsightedness. This class of medicine is usually prescribed to be used up to 4 times a day. Because of potential side effects and the need for frequent daily use, these medications are not prescribed very often anymore. Side effects. Because some of the eye drop medicine is absorbed into your bloodstream, you may experience some side effects unrelated to your eyes. To minimize this absorption, close your eyes for 1 to 2 minutes after putting the drops in. You may also press lightly at the corner of your eyes near your nose to close the tear duct for 1 or 2 minutes. Wipe off any unused drops from your eyelid. If you have been prescribed multiple eye drops or you need to use artificial tears, space them out so that you are waiting at least 5 minutes in between types of drops. Oral medications. If eye drops alone don't bring your eye pressure down to the desired level, your doctor may also prescribe an oral medication, usually a carbonic anhydrase inhibitor. Possible side effects include frequent urination, tingling in the fingers and toes, depression, stomach upset, and kidney stones. Surgery and other therapies. Other treatment options include laser therapy and various surgical procedures. The following techniques are intended to improve the drainage of fluid within the eye, thereby lowering pressure. Laser therapy. Laser trabeculoplasty is an option if you have open-angle glaucoma. It's done in your doctor's office. Your doctor uses a small laser beam to open clogged channels in the trabecular meshwork. It may take a few weeks before the full effect of this procedure becomes apparent. Filtering surgery. With a surgical procedure called a trabeculectomy, your surgeon creates an opening in the white of the eye, sclera, and removes part of the trabecular meshwork. Drainage tubes. In this procedure, your eye surgeon inserts a small tube shunt in your eye to drain away excess fluid to lower your eye pressure. Minimally invasive glaucoma surgery, MIGS. Your doctor may suggest a MIGS procedure to lower your eye pressure. These procedures generally require less immediate post-operative care and have less risk than trabeculectomy or installing a drainage device. They are often combined with cataract surgery. There are a number of MIGS techniques available, and your doctor will discuss which procedure may be right for you. After your procedure, you'll need to see your doctor for follow-up exams. And you may eventually need to undergo additional procedures if your eye pressure begins to rise or other changes occur in your eye. Treating acute angle closure glaucoma. Acute angle closure glaucoma is a medical emergency. If you're diagnosed with this condition, you'll need urgent treatment to reduce the pressure in your eye. This generally will require both medication and laser or other surgical procedures. You may have a procedure called a laser peripheral iridotomy in which the doctor creates a small opening in your iris using a laser. This allows fluid, aqueous humor, to flow through it, relieving eye pressure.